Hello and welcome, it's great to have you back. I'm UKMLAstudy and I'm a UK NHS GP doctor in IMG, and we're continuing our A to Z case presentation series where we discuss hypothetical scenarios and presentations that might come up on your exam and how you might want to approach these and points to consider. So we're continuing our A to Z case presentation series today with acute limb ischemia. Remember, there are three forms of ischemia in the limbs, and that could be that you have a patient who presents with intermittent claudication, or acute limb ischemia, or critical limb ischemia, and I'll make videos for the other two shortly. Now, you need to understand that acute limb ischemia is an emergency presentation and requires that that patient is assessed in A&E immediately, and that is because they may risk losing the limb entirely. So how would you identify an acute limb ischemia? Well, it's easily remembered if you remember the 6 Ps. So the first P is pain. So as you can imagine, if there is ischemia, that will cause pain, and so the patient will report that to you. Also, there's pulselessness, so the pulse may be lost from the femoral all the way down to the dorsalis pedis, and you can identify this on examination and comparing to the other limb. There's also paralysis, so that there's a loss of function of the limb. There's also pallor, so that the skin itself becomes pale in colour in comparison to the other limb, and that can also indicate ischemia. Then there's Paraesthesia, so that the patient complains of a tingling or a numbness in the limb relative to the other limb. And then finally, Perishingly cold, so that when you're examining and you're using the dorsum of your hand to compare the temperature bilaterally, you find that one limb is very cold in comparison to the other limb. So if you find these features present, then you need to admit this patient so that they can be seen by the vascular team to try and identify where the possibly a thrombus might be, and so that they can act on it. And usually this requires either some sort of blood thinning agent, or even a procedure or a bypass of some sort to regain the perfusion to that limb. So I hope it's been helpful for you. If you have any comments or concerns, let us know, and I'll see you on the next one.